Right now, we are going to take you inside the Crosse County Health Department's building, where a press conference is set to get underway with some updates. Let's listen in.
At the present moment, we remain at 5 positive lab-confirmed cases. We have no deaths in our county. In the state, we are now at 416 cases with 7,050 negative tests and 5 deaths in the state of Wisconsin. So I, at this time, want to remind all of those that are watching that we do have a call center available to answer your questions, and that number is 608-785-6240. And there are individuals that are waiting to answer your call and help you get the response that you need to know how to be healthy and safe in our community right now. I do want to just briefly talk about the press release we sent out yesterday in relation to the exposure. So we are hearing from individuals, and we're grateful for those that are contacting us who think they may have been exposed with that situation. So let me go over that briefly. We had an individual who is not a resident of our county, who is currently hospitalized with severe symptoms and is a confirmed COVID-19 case. So he was in our county on March 11th, and this was the day before he became symptomatic. So we're being cautious with our going back 24 hours prior to symptoms beginning. That individual on March 11th was at a funeral at St. Patrick's Catholic Church in Onalaska, and then was at Red Lobster in Onalaska. The reason we notify those in the public is because we have no way to know at an event like that who was in close contact with that individual. Again, he's in the hospital, and we wanted to make sure that individuals in the community would be aware if they were at those locations. They can utilize the form we've provided that will be located on our website, www.lacrossecounty.org/COVID-19. You can go to that website and find the form. You can fill that out, and you can let us know if you think you were exposed at that event, and we will contact you, and we'll be screening those based upon if individuals have symptoms. So we're already well into what would be the quarantine period for individuals who may have been exposed. We think the exposure risk was very low. That individual, according to family members, was not in extreme close contact with a lot of people. So we think just because there were a lot of people there, we wanted individuals in our community to be aware of that potential risk. So the general message would be stay home, especially if you are symptomatic right now, stay home. You do not necessarily need a test to know that you need to stay home. Individuals who work in healthcare or on the front lines may receive different guidance because they will be in contact with their employer, so Gunderson Health System and Mayo Clinic Health System, and those that are in police, fire, and emergency medical services. We sometimes have a different message because we need individuals to be available to the public. So we have a process that we're going about to determine the level of risk for those individuals to assure the health and safety of the public. So just know, not everyone may be told the exact same thing. It has to be strategic based upon risk. I will also just say that we are grateful that in our community we have a very strong group of individuals that are working very hard to have a plan for our homeless population. So I want to give a shout out to folks like Julie McDermott and Sandy Brecky in our community and many others who are working hard to support the homeless population in our community. We've already had a couple of individuals who had symptoms. They are humans in our community that deserve to be treated just the same as anyone else. And we are working really hard to make sure that those individuals get what they need and are not exposing others to respiratory symptoms, including COVID-19 or influenza or other potential viruses or bacteria. Again, I'll just reiterate, this virus does not discriminate, and neither should we. And that is a message we will continue to share because it's very important that we remain a community during this time, and that we work very hard not to judge others that might have been potentially exposed because the virus does not discriminate. Lastly, I want to address how the community can help. So we have received so many wonderful positive emails and calls from members of our community who want to know what they can do to help. So I have a couple of suggestions, and we can work on some more as well. First of all, this sounds simple, but we would ask you to stay home. We think that that is one of the most important ways that you can help. May not be what everyone wants to hear, but it is so helpful to our community right now. Secondly, if you are able to donate blood, we would ask you to consider donating blood. You can visit redcrossblood.org or Versiti, VERSITI.org to learn more. Third, you could donate financially, if you are able to the La Crosse Community Foundation, who is partnering with United Way, and they are going to work to support those in our community who need it. And that can be done by visiting the La Crosse Community Foundation's website at laxcommfoundation.com. Fourth, we want to talk a little bit about masks. So we have had a lot of individuals in our community who are wonderful sewers and want to work hard on helping us with masks. So we are currently exploring this idea. We want to make sure that if we do that, it's done in a coordinated way and that we know what the best way to produce and sew those masks and create those masks that will be effective in the situations where we would deploy them. We also want to make sure that we have an understanding of where they need to go and that they will be utilized, because we don't want to have that be a mismatch in our community. So we're working on exploring that suggestion, and we will let you know as soon as we know more information on that. Fifth, we want you to call and check in with your loved ones and your neighbors and family. You can't go over there and spend time with them necessarily right now, but you can call. And there are lots of virtual ways to connect. And we need that social connection as human beings. So we would ask you to do that, to reach out to those that you love and that you are friends with, and just check in with them. I know personally I'm getting a lot of check-ins, and I'm really grateful for that. So we have to do that for each other. And lastly, if you can, we would ask that you support your local businesses. Even in the health department, in our incident command structure, we are daily rotating to order our lunches from a local business in order to support them. This is a tough time for local businesses, and if we can help them by purchasing things online, doing takeout, that would be a great way to support those local businesses. I will also say that I am aware that Governor Evers has announced that he intends to put out an order tomorrow. We call this Safer at Home. And he is looking at ceasing all non-essential business, and what is yet to be determined is what is essential. So we do at this time know that essential means healthcare workers, it means grocers, and it means family caregivers, and we are waiting for additional details on what essential means. In addition, his order will talk about essential travel. So specifically, this would be for necessary doctor's appointments. Again, many doctor's appointments might be canceled right now if they're not essential, and always calling first before we go to the doctor's office. It would be travel to the grocery store and travel to receive medication, and those should be in and out types of travel situations. So I would encourage you to be cautious when you make those essential travel trips, that you are thinking about washing your hands before you go. You get there, you do not touch your face while you're in the facility getting what you need. You come out of the facility, if you have hand sanitizer in your car, utilize that. Otherwise, when you get home, you wash your hands again with warm water and soap. And avoid touching your face during that time. That way, in case you touch a surface that might be contaminated, you can reduce the risk of becoming exposed to a virus or a bacteria in the community. So with that, I will open it up to questions.
So the numbers have sort of stayed small here in La Crosse County. Do you What is your reaction to that, of the numbers staying only under 5? And do you expect this week there maybe to be a spike in that? Just talk a little bit about the numbers here.
So the question is, the numbers have remained small in La Crosse County. Do we expect that to change? I am hesitant to predict what will happen. I do continue to expect additional cases. Every day we have individuals in our community that are being tested, and I expect that we will have increased cases. I am grateful that those numbers remain small, but I do expect more cases to happen.
Do you have numbers on how many of those tests have come back negative here in La Crosse County?
So the question is, do we have numbers on how many tests have come back negative? At the present time, we're working to have a better system in place of how many tests are done and the ones that are coming in negative. We have a number of different labs that involves, and as soon as we can have an accurate number to report, we will do that.
How many people have contacted the health department after having contact with that church and that red officer as well?
So the question is, how many people contacted the health department after the notification about the potential exposure at the church? So I can tell you that as of last evening, which was a matter of hours, we had 45 individuals who had filled out that form. And that was wonderful to see because we could very quickly identify who might be at risk, particularly those that might be working in a healthcare role, and we could quickly get in touch with folks to give them guidance about what to do. But in general, the guidance would be to stay home, and we would anticipate anyone who has symptoms would automatically do that, but we can't reiterate it enough. And then also, if you were notified and you were in those locations, it's just a few more days here that we would ask you to stay home under quarantine without symptoms.
And then is the county or any of the surrounding healthcare systems trying to find alternate sites to kind of treat for COVID-19? Like, for example, the Green Island Ice Arena?
So the question is the county or healthcare facilities looking for alternate sites to treat for COVID-19? So I can't speak to what the hospital systems are doing. We call this surge capacity. So that means that when they might have additional patients coming in who are sick, which we don't have right now, that they would have additional capacity available to provide care for those that are in need with severe symptoms. So I can't report on what the healthcare system is doing. That is not a function of the local health department.
You mentioned symptomatic. What exactly is this? If someone just has a simple runny nose or a headache, how serious should they be taking that, and just reiterating to stay at home even if you have something small like a headache or sniffles?
So the question is, what are the symptoms that we're looking for to understand the risk level? So I'm going to start by saying we don't need a test to know what we need to do. So whether you have symptoms or not, you're really just asked to be home right now. And again, we talk about you can be outside in your backyard, get fresh air, do positive, healthy things. But if you have a runny nose or the sniffles, those are not typically the symptoms associated with COVID-19. What we look at in particular would be a dry, perhaps productive cough. You might have a fever over 100.0 degrees. You might also be experiencing body aches or muscle aches. We have seen individuals who have had a sore throat associated with this, though that is not the most common symptom, and you can have difficulty breathing. So those are some of the key symptoms we watch for, and we just again say that if you are feeling really, really sick, to include difficulty breathing, you need to call 911.
In terms of kind of La Crosse's population versus available hospital ICU and regular hospital beds, do you have a ratio that you're working from, and is there more or less a number you're trying to get to? I realize that there's not healthcare.
Yeah, so this is really a question about the capacity of the healthcare system to serve those in need. So again, right now, the capacity of the healthcare system is holding strong, and there are no concerns about the number of beds or the equipment available to treat patients. They are working to be prepared for what we call that surge, where they might have additional people that goes above and beyond their normal number that they would need to serve that have severe symptoms. And they are preparing to be ready for that situation.
And do you know if any maybe retired workers in the healthcare field are being asked to come
So the question is, are there any retired healthcare workers who might be asking to be coming back to the system and assisting during a situation where they need additional workers? I'm not aware what they're doing in the healthcare aspect. I can tell you that we have had some of those conversations here, and we actually have an individual or two that have worked in public health, and we have brought them back in to support, as well as other county employees are being redeployed to assist in locations like our call center and just other human resources needs that we have. So it's been really delightful to see how we're all working together to make sure that we have the capacity needed. To even include if we are willing to work with long-term care facilities to support if they need somebody to be sitting at their door when their healthcare workers come in to work, to assure their temperature is checked and their symptoms are checked appropriately. We've also, we want to support the healthcare systems in employee health. They have sometimes small employee health units, and they are mighty, but still, we're working together all the time to determine where are more people needed and how can we get those people where they're needed. There is also something called the Medical Reserve Corps, which is a unit of retired medical professionals, and we have an active Medical Reserve Corps in our county, and those folks are already being asked to help in certain roles.
Moving forward, what would change with Governor Evers' new order?
So the question is, what would change with Governor Evers' new order? What would change is that anyone who wasn't previously part of the order in the past would be part of this order now, with the exception of whoever his order says are essential workers. So again, we know that those are healthcare workers that are essential. We know that those are grocers, and we know that those are family caregivers. Beyond that, unless they're determined to be an essential workforce, they would be under this new order of safer at home.
It seems like a lot of the countries may be frustrated with access to testing or restricted qualifications. What would you say to people in the county who are frustrated with that?
So the question is, how do we address testing and the concern about wanting to get testing or not understanding, what testing is available and to who? So right now, through the Wisconsin State Lab of Hygiene, they have 4 tiers of testing. And in the state, because of the testing supply, to assure that there's enough supply for the most needed individuals to be tested, they are testing level 1 and 2, or tier 1 and 2. And those typically are those that are sickest, typically hospitalized patients, as well as healthcare workers with symptoms. So what doesn't typically fall into that are special populations like the homeless, or healthcare workers that are not symptomatic, or individuals that we would recommend from public health be tested because we'd like to make sure we know who to do contact tracing on. It doesn't mean that that testing cannot occur. It just means that they don't fall into the tier 1 or 2, which are the automatic tested. So it means that there has to be special requests to assure that that testing is getting completed. That hasn't been a huge problem to this point, with the exception of the public not understanding why, if you want to get a test, that you can't get one. So again, I just reiterate that we really do not need a test in most situations to know what to do. We know that we should be home right now. As a country, we should be home right now. And we know that if we have any symptoms at all, particularly mild symptoms, because there is more evidence to show that those that might have been exposed don't have symptoms, as well as those that have mild symptoms, can be spreading this more than we previously thought. And that's because individuals are used to sort of toughening it out and going to work and being out and about, even if they don't feel extremely sick. So the message continues to be, we have to stay home, we don't need a test to know what to do, and there are tests available for those that are in high priority areas.
To piggyback off that, on Facebook, someone was asking, is there any way to know that you have COVID-19 without a test?
So the question is there any way to know that you have COVID-19 without a test? I can see that would be difficult. You would want to know if you do or do not have it. But remember, even for those who are tested, and they get a negative result, that is not a clearance test. That doesn't mean that they don't have COVID-19. So I know that that can be frustrating, but if you have any symptoms, you need to be home. If you have been in contact with someone with a case that's been confirmed, those are individuals that we would recommend be tested so that we can find out who they've been in contact with. But otherwise, any of those symptoms, really you just need to stay home. It's sort of like influenza, right? We don't go in and get tested for influenza every time we have influenza-like illness, particularly if they are mild symptoms or moderate symptoms and they are not severe. Because if you think about this, there is no cure for COVID-19. It's a virus. It needs to run its course. And the people that need care are those that have severe symptoms and require hospitalization.
People who may have been at Red Lobster after this insert, do they have anything to worry about, or had Red Lobster been cleaned and they have nothing to worry about other than on that specific date?
So the question is, do we need to worry about Red Lobster outside of the window of March 11th from 6:15 to 7:30? No, you do not. So let's go back to how this disease spreads. So this is a disease or a virus that spreads through droplets. Typically, you need to be within 6 feet of an individual who is actively coughing. And again, this was on the day prior to the symptoms beginning. So we know that day prior, we don't have enough evidence yet to say that that is not a risk level. But that person was not actively ill at the time. So even during that 6:15 to 7:30 time on March 11th would have been a very low risk situation, but enough that we wanted to let the community know about it. So if you were there after 7:30 or the next day, you do not need to worry about potential exposure to COVID-19.
We're seeing the public in a lot of the larger cities almost being scolded by city officials that maybe they're not doing enough. Is that something that you're concerned about here? Is there anything that you've seen, especially over the weekend, that you're just really not happy with, that you want to really stress to a viewer watching at home?
So the question is there anything that I would really want to stress to the public about that I might be seeing and concerned about? In general, I'm very, very proud of this community and what this community is doing. There will always be some members of our community that either cannot or choose not to take the recommendations seriously. I think this is part of why we see orders coming across from the governor and from the president in regards to staying home that we've never seen before. And it's because we know that we've got to really take strong actions now to keep these cases from spreading, or we will not be able to contain the situation. So there have been some that haven't listened to the guidelines and that have been, that our local police departments have connected with, and I think that's been addressed promptly and in a very efficient manner. I do worry about locations that are really trying to do the right thing but don't have enough staffing. And so, we're trying to be available to those locations to help guide them about what best to do to prevent the spread of COVID-19. But in general, I would say I'm really proud of this community. I think we're doing a very good job. We need to remember that even trips beyond the grocery store to go get things out in the community, we have to be very careful. And, we're going to get an order from the governor that says those are not essential and we really need to be home. Okay, thank you.
And you've been listening and watching live to a press conference underway held by Jen Rombalski, the Health Department Director for La Crosse County. Jen underlining there that there have only been 5 confirmed cases of COVID-19 in La Crosse County. That number has stayed the same for several days now. She did touch on the alert about potential exposure to COVID-19 to people in the community on March 11th. At St. Pat's Church and at Red Lobster. You can head to wxow.com/coronavirus for more details on that. She did underline the directive for people to be staying at home, and she said that she's gotten questions from many in the community about how they can be helping right now. Her number 1 recommendation was to do that. Stay at home. That's how you can be helping. The health department has set up a call center. They have a number for you to call with your questions about coronavirus. And you see that on your screen, 608-785-6240. That call center is open right now, and your questions will be answered if you call. For now, we're going to return you back to regular programming. Our coverage continues tonight on Live at 5. Thanks for watching.